Dr. Richard Rosenfeld, AAO-HNSF Senior Advisor for Guidelines and Quality, is recognized internationally for his innovative methodology in developing clinical practice guidelines and clinical consensus statements. In 2017, Dr. Rosenfeld and the several physician volunteer work groups developed 21 otolaryngology-specific measures using 3 different methodologies. With lessons learned and looking towards the future, Dr. Rosenfeld is here with us to provide an update on current measure development initiatives.
Thank you so much for the opportunity to discuss these exciting times for measures development at the Academy and our clinical data registry. I'd like to give you a brief overview of where we've been, what's happening now, and what to expect in the future as we charge ahead. So, in 2017, our Academy staff accomplished the superhuman task of submitting 21 otolaryngology-specific quality measures to the Centers for Medicare and Medicaid Services. And incredibly, 18 of these were provisionally approved for the Clinical Data Registry and MIPS, that's Merit-Based Incentive Payment System reporting. These are a potpourri of measures spanning almost all aspects of the specialty, including middle ear fluid, cerumen, earwax, allergic rhinitis, age-related hearing loss, Bell's palsy, and ear tube drainage. Well, that's a great start, and as of now, we have 70 quality measures in the Reg-ent registry to allow really effortless and seamless quality reporting for clinicians through their electronic health record. As I mentioned, 18 of these measures were previously submitted and developed for our members. These are accessible only to our members through Reg-ent. There's an additional 44 through the Quality Payment Program. And these are measures developed not just by otolaryngologists, but by others. And they include some otolaryngology-specific measures such as acute otitis externa, adult sinusitis, and antibiotics for middle ear fluid. These are publicly available. The last group of 8 measures are again only in Reg-ent for otolaryngologists. They're specialty-specific, and they're being used for validation and gap analysis. So this includes things such as tonsillectomy bleeding, laryngoscopy, and evaluation of dysphonia after thyroid surgery, and some age-related hearing loss and cerumen measures. So what's really particularly exciting about where we are now is the robust evidence-based methodology that has taken us to this point so quickly. We use a variety of sources to develop our measures. We begin with our clinical practice guidelines, which have been highly recognized and lauded by others for their quality and adherence to the Institute of Medicine standards. So our key action statements form the basis for many of our measures. We've developed de novo measures from scratch for age-related hearing loss, and there's an effort going on now for some oral cancer measures. We also use e-specifications, a very cutting-edge process whereby we work with ECRI, a nonprofit group, to really extract measures out of our guidelines electronically, and we've done this for cerumen impaction and allergic rhinitis. And last, we collaborate with others. We have worked with external groups, the American Neurologic Association, to develop measures for benign paroxysmal positional vertigo, as well as the American Society for Plastic Surgery to develop rhinoplasty measures. What's new and exciting is the emphasis on patient-reported outcome measures, or PROMs. These are measures that have traditionally not been emphasized. We focused more on process, but outcomes of patients are increasingly important. There are some challenges in getting the data because it can be longitudinal, it may need risk adjustment, and we have to agree upon validated measures, but this is the future. And we're also using the new technology in the ENT registry, Reg-ent. But we can actually use Reg-ent to identify patients who had tonsillectomy, reach out, and survey them about their experience to pick up bleeding. In concluding, I'd like to talk a little bit about the future and why it's so exciting. There's always ongoing stewardship issue of measures throughout their life cycle, which is difficult. And we really need to work on improving the technical specifications for pulling data from the EHRs into the registry, and for getting data from keywords and from the natural language processing aspects. So these are challenges ahead. We have to annually submit our measures to the Centers for Medicare and Medicaid Services. We can submit up to 30 for the registry. And since we have so many, we're now looking towards composite measures. So for example, taking all the measures, there are 4 of them related to medical therapy for middle ear fluid, and combining them into a composite measure. We're looking at a composite measure for oral cancer screening and treatment. We're also looking to leverage our infrastructure and our clinical advisory committees, the CACs. These are really groups of leaders in their fields and the subspecialties who have advised us so far and helped us prioritize our efforts, but we hope to really use them in the future. So for example, we have asked our clinical advisory groups to identify the key patient-related outcome measures in their fields that are validated and that should be used to document how our clinicians are paying attention to these issues and documenting them in their records. We'd also like to use the patient-reported measures for clinical change going forward. We have asked our CAC groups to identify gaps in care, pragmatic things where otolaryngologists could and should do better. And these could be areas of underuse, overuse, abuse of various services, diagnostic procedures, interventions, etc. And last, we've asked our CACs to identify some benchmarking opportunities. So areas where we may want to look across the country and see to what extent an otolaryngologist is doing a certain intervention in patients or using a procedure, a diagnostic test, a type of instrument, and this will allow us to really identify areas where there are outliers that could then serve as the basis for measures going forward. So in summary, I think you can see it's been a whirlwind of activity so far. We've come a long way. The database Reg-ent at this time is approaching close to 10 million patient encounters and above 4 million patients enrolled, and I think the future is bright. With the help of all our engaged otolaryngologists, our clinical advisory groups, and our wonderful staff at the Academy. Thank you for listening to this update and for being a part of this really exciting activity.